Let's discuss issues involved with psychosocial health and disabilities. Psychosocial health refers to the mental, emotional, and social aspects of your life. Problems can be anything from anxiety to your social environment.
Disabilities not only affects one's physical health, but may also have negative effects on their psychosocial health. Eyster studied work-related injuries and related psychosocial effects. Limitation or restriction from work-related responsibility and social activities led many participants to suffer from fear, anxiety, and depression. The study focused on the importance of work in people's lives. Many people choose a career in which they're passionate about. Many find a sense of belonging or community with co-workers or others that share the same profession. When people can't do their job, it almost takes a part of their identity away. If you add the inability to participate in social, leisure, and independent activities, then this may have extreme negative effects on someone's psychosocial health. That's why, as PTs, we must recognize the effect of disability and treat the patient as a whole person, physically and mentally.
Although physical therapists' scope of practice is to treat the physical injuries and limitations of patients, the biopsychosocial model reminds us that the psychological state of the patient can have a major impact on the outcome of physical therapy. Depression and chronic pain are common comorbid conditions. A study conducted in Canada tracked levels of depressive symptoms at pre, mid, and post-treatment for each patient. Results showed that when physical function increased, often depressive symptoms decreased. In the study, 40% of patients' depression levels decreased with physical therapy intervention. When depressive symptoms did not improve by mid-treatment, it was often an indicator that the patient would not see long-term improvements in pain and depression. This is where additional outside intervention within a different clinician's scope of practice is warranted.
One final piece to psychosocial health is a strong social support system. In disabled patients, this is even more important because of their lack of belonging and community that we learned about earlier. A research study looked at the relationship between the physical therapist and parents of disabled children and how this affected therapy program adherence. The study found that parents who can learn the therapy program and demonstrate the exercises improves not only their confidence but also their child's. When the parents felt comfortable with the program, the child's adherence and motivation to complete the program improved, and thus improving their psychosocial health. Ultimately, when working with disabilities, the therapist should always consider the patient's psychosocial health and well-being.